So Anthony Chaffee, the fake MD carnivore doctor, called me out.
Big food companies pump out the vast majority of nutritional studies, and it's all that nutritional epidemiology. It's all to push processed food and crap, and saying that sugar is safe or aspartame is safe, and they get these influencers to pay them off to say that, oh, aspartame is really good. Dr. Ids, he got caught saying, oh, aspartame is actually healthy and all is really good for you, but he was actually paid to say that, and he didn't disclose that he was being paid to say that. Dr. Ids, IDZ.
This is going to be a fun one, so before I expose him for being a fake, let's quickly address his claims about me. Time to school. Firstly, he claimed that I make videos saying aspartame is really good and it's actually healthy for you. This is a terrible misrepresentation of my content because anyone who actually listens to my videos knows that I've never said that artificial sweeteners are good for you. What I do discuss is their safety. Remember, something being safe to consume and something being good for you are two very different things. The reason I've done several posts on them in the past is because hundreds of people make fear-mongering videos about them, claiming they cause cancer, obesity, diabetes, and even stroke based on extremely poor science. Debunking these myths with evidence from dozens of controlled human studies every time I talk about it is not saying they're healthy for you. Secondly, aspartame is safe. We have meta-analyses of literally hundreds of controlled human studies showing that artificial sweeteners don't impact glycemic markers. They don't negatively impact your weight. Interestingly, compared to sugar or even water, they could even aid in weight loss. And the evidence is abundantly clear there's no reason to fear them. Which is why the European Food Safety Authority, the Joint Expert Committee on Food Additives, Food Standards Agency in the UK, Food Standards Australia and New Zealand, and basically every leading healthcare country across the world, including those with free socialized care, agree that it is safe. So if you think aspartame isn't safe, then you're simply choosing feelings over facts. Moving on, apparently I'm a paid shill and I've been caught for not disclosing a partnership. This just shows you how poor his ability to investigate and interpret information actually is. First of all, I didn't hide the fact that I worked with the ABA to educate people on the safety of aspartame. I literally put paid partnership. The issue they had was the adequacy of the disclosure, not the fact that it wasn't disclosed. They wanted an audible disclosure in the video too, so for me to actually say paid by the ABA in the video. Which doesn't make sense because it's very rare for American creators to audibly disclose any partnership in any video. Look at Flav City for example, no audible disclosure, just paid partnership. Look at Mark Hyman, clearly promoting his functional health clinic, yet no paid partnership label. So expecting me to do something that is not common practice amongst creators is kinda silly. Also realise that the warning letter was from the FTC, which is an American organisation, and I'm not American. I follow the Advertising Standards Authority in the UK, and on their Influencer's Guide to Making Ads Clear document, it clearly states that simply putting ad with or without a hashtag, or using the paid partnership feature is sufficient for any partnership. Which is exactly what I did. So no, I didn't lie about having a sponsor, and that's the second false accusation he said against me. He's also claimed that all of my education is run by the Seventh-day Adventist Church, which is so ridiculous I'm going to leave it there. Now, on to the juicy part. Speaking of failing to disclose things, did you know that Anthony is actually not an MD? On his YouTube with over 300,000 subscribers, he states that he's an American medical doctor. And on his bios and username, it says MD. That's interesting because he can't be found on any American national database for doctors. Even on the Australian medical database, there is one entry for Anthony Chaffee, which shows that he has a Bachelor of Medicine, Surgery and Obstetrics from Ireland in 2013. But no mention of MD anywhere. Oh, and get this, in his bio he also put nutritional research. Now, I don't know about you, but this implies that Anthony is active in the nutrition research space. You know, perhaps he's published some research or has a degree in nutrition or research for that matter. But interestingly, there are no publications with the author Anthony Chaffee as well as no nutrition degree. So when he claims that he's a nutritional researcher, what he actually means is he Googles some shit and poorly interprets research. So that's another thing he's lied about. You really thought I was done? Oh, there's more. Also on his about section, he claims he's a neurosurgical resident. This implies he's training to be a neurosurgeon. And guess what? He's not even in training. And I know this because I've had direct messages from old colleagues of his, which I'm going to keep private for now, who can confirm he isn't in any surgical training program. So he lied about that as well. Now, some people may think that these things aren't really a big deal, but it's so important to be transparent and not mislead your audience when it comes to your qualifications. I have almost 3 million followers on social media, with the vast majority of them being from America. I could easily put MD next to my name to boost credibility and gain a lot more traction, but I don't do that because I don't have an MD, it's a completely different qualification. I put my actual credentials, which is the MBBS degree, which is the main medical degree in the UK for doctors. People are desperate for help when it comes to their health. Statistics show that 1 in 2 Americans get misinformed on social media. And seeing as though Americans are a huge part of the social media space, putting American doctor, MD, and nutritional research next to your name is a false appeal to authority in order to get people to trust you. The fact he's willingly lying about his own credentials not once but multiple times immediately puts into question his credibility and willingness to deceive you for monetary gain. You might say, well, what is he selling? He's just telling people to go on a carnivore diet. Well, the list of things he's selling is longer than his fake qualifications. He sells 30-day carnivore challenges, big steak delivered to your door, natural tallow and soaps with a discount code, the carnivore bar with another discount code. Oh, what's this? X3 bar system with another, you guessed it, discount code. And there's more where that came from. Now, just ask yourself, if he's willing to lie to hundreds of thousands of people about his qualifications to position himself as some kind of authority, then you should wonder what else he's lying to you about. This is the man who is not active in academic research, has no relevant nutrition training, who genuinely believes that vegetables are harmful for you. Let that sink in for a second. He believes he's figured something out that all of medicine globally hasn't. All of cardiology, all of the Royal Colleges of Medicine, all of the healthcare institutions globally, all of the top nutritional researchers around the world. This guy thinks he knows better. Do you realize the level of narcissism and delusion you have to genuinely believe that? It just gets worse. Even when debating, he doesn't even know the methodology of the studies he's citing for his own arguments.
Found that correcting for socioeconomic factors, that meat was a positive factor on life expectancy.
Are you familiar with how they tracked meat intake?
I'd have to look at it, but no, go on.
Yeah, so they actually didn't track meat intake. They tracked food, like meat supply data from each country, and didn't even use the loss adjusted numbers, which is bizarre. You should at least use that.
It appears that all he can do is cherry pick some rubbish cross-sectional data to show red meat makes you live longer and then just misinterprets it. Even one of the biggest proponents of the carnivore diet in the world, Paul Saladino, has stopped being carnivore because of the horrible effects it had on him.
2 years into the carnivore diet, I started noticing persistence of unpleasant symptoms. So testosterone dropped to around 500 total, sleep disturbances, palpitations, muscle cramps when I was surfing or climbing.
And the original guy, Sean Baker, who put the carnivore diet on the map, said this.
I don't know. I will say, I don't know if my diet is going to make somebody live longer. I don't know if it's going to either prevent or increase the likelihood of some disease, because we just don't have the data that shows that now.
Both of these people, the founding fathers of the carnivore diet, directly go against what Anthony says, even admitting the evidence is simply not there to recommend going carnivore long term. So, let's recap what we've learned today. 1. I didn't hide any disclosure, I've not lied about anything, and I followed my country's marketing guidelines to the T. 2. Aspartame is safe, every major health institute around the world agrees, and I've made several videos on the safety of aspartame before any partnership was made, so to claim I was paid to say something is stupid. 3. Anthony is a liar, he lies about his credentials. He lies about being an American MD, he also lies about being a nutritional researcher. He lies about being a neurosurgical resident when he's not. 4. He genuinely thinks he's figured something out that all of medicine around the world hasn't, by claiming that vegetables aren't good for you, whilst not having any formal training in nutrition and, well, not being a medical specialist in anything. 5. He can't seem to read or interpret research well at all. I mean, just watch the debate between himself and Dr. Nagra, which is essentially 2.5 hours of Anthony getting his ass handed to him. And finally, if you want to trust someone who willingly misleads and lies to his own audience about his credentials, doesn't know how to interpret research and goes against every actual nutrition expert and researcher, then I'll leave that to you. Class is missed.